Hi, how are you? This is Avibwan. In the previous video, I've discussed the research I did about Alzheimer's disease, its history, how the disease affects the brain, causes, gender, and ethnicity. In today's video, I'll share more information about its symptoms and signs, the difficulties in every stage of the disease, risk factors. So, let's get started. This is the image of a normal brain. This is an image of a brain with Alzheimer's disease. And this is the comparison between a healthy brain and a brain with Alzheimer's disease. Although Alzheimer's disease is not a normal part of aging, it is still the seventh leading cause of mortality in the United States. The fifth leading cause of death for people aged 65 years and older, and the seventh leading cause of death worldwide. Alzheimer's disease is the result of complex changes in the brain that start years before symptoms appear and lead to the loss of brain cells and their connections. It is also the most common cause of dementia in older adults. Alzheimer's disease can affect people differently, and each one will experience the symptoms in their own way. These are the common symptoms of Alzheimer's disease. Before symptoms can be detected with current tests, plaques and tangles begin to form in brain areas. During this stage, a person begins to experience memory loss and other cognitive difficulties. At this stage, more plaques and tangles develop, which results in greater problems with memory or thinking, serious enough to interfere with work or social life. Middle stage Alzheimer's is typically the longest stage and can last for many years. As the disease progresses, the person with Alzheimer's will require a greater level of care. Damage occurs in areas of the brain that control language, reasoning, sensory processing, and conscious thought. Plaques and tangles also spread to areas. During the severe stage, most of the cortex is seriously damaged as the brain shrinks dramatically due to widespread cell death. At this stage, a patient with Alzheimer will lose its ability to communicate, will be completely dependent on others for care, and may stay in bed most or all the time as the body shuts down. Memory and cognitive skills continue to worsen. Age is the biggest factor in developing Alzheimer's disease. Most people over 65 years old are affected with the disease, and above this age, the percentage of developing the disease doubles every 5 years. There are about twice as many women than men over 65 years old with Alzheimer's disease. There is a type wherein it is clear that Alzheimer's disease is being passed on through the genes from one generation to the next. There is no cure for Alzheimer's disease, but there are treatments that may help change the progression of the disease. There are drug and non-drug options that are available, which may help lessen the symptoms and improve the quality of life of the patient and their caregivers. Please remember that patients with Alzheimer deserve the same care, love, and respect, just like you and me.